Hi, my name is Hannah and I'm doing my presentation on Eikenella Corrodens. Thumb injuries are the absolute worst. Here we have the patient history. A 13-year-old male presented himself to the emergency room with pain, swelling, and redness of his right thumb. The patient had mentioned this had been going on for 4 days before coming into the emergency room. Here we have history of present illness. Earlier in the week, the patient accidentally punctured his right thumb while playing a friendly basketball game with a couple of friends at a local park. The patient and a friend had a scuffle for the ball, and the friend accidentally grazed the patient's side of the thumb with his tooth. The patient's right thumb became tender and what seemed to be infected. Previous medical history. The patient has no previous medical conditions or known allergies. Patient is also up to date on all immunizations. Physical examination. The patient has a temperature of 100.5, pulse of 96 beats per minute, a blood pressure of 110/68, mild lymphadengic streaking seen up the forearm, right thumb shows redness and inflammation near the puncture site. Here we have the patient's labs. The patient shows a white blood count of 13,000. We have neutrophils at 80%. The patient also has a CRP of 7.5, a SED rate of 45. Blood cultures show no growth after 5 days, and we have a wound culture that shows growth of Eikenella Corrodens. Explanation of labs. The patient had an elevated white blood count. This elevated white blood count suggests that the patient has mild leukocytosis. The patient also had 80% neutrophils, which suggests neutrophilia. The patient had an elevated CRP and SED rate, which suggests inflammation and infection. Blood culture suggests no bacteremia, where there was no growth after 5 days. The wound culture is confirmed by PATH that the patient does have Eikenella Corrodens. Eikenella Corrodens. Eikenella Corrodens is from the HACEK group. This group is known for fastidious gram-negative rods. Eikenella Corrodens is oxidase positive, catalase negative, nitrate positive, and indole negative. Eikenella Corrodens is also known for its bleachy odor, Pitt's auger, and 3 zones of growth. It is also periodontal and jaw abscesses. Over on your right, there is a plate that actually shows the growth of Eikenella Corrodens. This is actually something that was grown on a patient and worked up. Other notes and findings. Eikenella Corrodens is a capnophilic bacterium. In this case, this means that the organism grows best in an increased CO2 environment, 5% to 10%. This organism took roughly 5 days to set up, grow, and work up. Antimicrobial susceptibility. Eikenella species are characteristically resistant to clindamycin, aminoglycosides, in vitro sensitive to ampicillin, carbonicillin, chloramphenicol. Forgive me if I pronounced those incorrectly. Google was no help. References. For my presentation, I chose to do Wikipedia for Eikenella Corrodens and I also used Clinical Laboratory Science Review Book, A Bottom Line Approach, 6th edition by Patsy Giroux, page 165. And this concludes my presentation. Thank you.